Okay, so we have a lot to wrap up here in Module 4, so let's get to it. Earlier, we looked at the fact that there's multiple levels of government responsible for the administration of TANF. The same is true for SNAP, or the Supplemental Nutrition Assistance Program, what most people call food stamps. You've got the U.S. Department of Health and Human Services, which oversees TANF, but in the SNAP program, it's actually the U.S. Department of Agriculture. So that might seem a little odd or a little different, right? But it's still the Department of Human Services at the state level that administers SNAP in Tennessee. So when you look at eligibility for SNAP within Tennessee, and you'll notice the state of Tennessee still calls it the food stamp program, which is a bit confusing because sometimes they do call it SNAP, sometimes they don't. You can see here a calculator on their website where you can calculate whether or not you're eligible for the SNAP program. You can see the different criteria here, and you can actually plug it in, and it will tell you, whether or not you're eligible. And so, just memorizing eligibility guidelines, that's going to change from year to year based on adjustments, that kind of thing. So being able to go and use that calculator, look it up, is a more beneficial skill to have rather than just like knowing what the requirements are. Now, there are limits on what you can buy with SNAP, and you can see some of the things here that are yeses and nos in terms of things you can buy and some things that you can't. You might notice in the yes category down at the bottom right there, bows and arrows, and that might be new information to you. But for example, in the state of Alaska, and this is a document put out by the SNAP administrating agency in Alaska, they say, do you know that you could actually purchase hunting and fishing gear with your SNAP benefits? And it's limited to nets, lines, hooks, fishing rods, harpoons, knives, ice augers, and other equipment. You can't buy firearms or ammunition or things like that. But it gives the specific counties here. And the idea is that part of the native tradition there within Alaska is to go and actually fish and hunt a lot. And so it recognizes that might be a more cost-effective thing, is to help buy some of that fishing equipment specifically. Just want to quickly look at these statistics for Tennessee in terms of the average benefit amount. You can see for all households, the SNAP benefit amount is roughly $246 a month. For households with children, $414. For working households, meaning there's someone that's working in the house, $318. For households with seniors or older adults, $87 a month. And then households with disabled individuals who are not older adults, $167 per month. And you can see at the top there that the average SNAP benefit for each household member is $131 a month, and the average SNAP benefit per person per meal is $1.32. Now, keep in mind, you can see the $131. You can notice that, for example, the household with older adults, it's just $87. So that $131 is an average. If we look at the benefits per person, like how much it is, you can see the dollar amount scale at the bottom. You can see Tennessee is actually in that, next to the highest group. So it's doing better than some states, for example, like Arkansas and Mississippi, which is in the lowest group. Another quick analysis here, just like we looked at welfare, drug testing. So on the state and federal level, there have been a lot of proposals to try to ban sodas as something that SNAP beneficiaries can purchase with their benefits. And those proposals have largely failed. Now, there are people that support them on the right that are more conservative. They're like, we shouldn't be wasting taxpayer money on sodas. There's people that are more concerned about the health of the beneficiaries that say, well, they don't need the sodas, so let's just help them by making it where they can't purchase the sodas. But one of the things that you'd want to keep in mind when you're looking at SNAP beneficiaries is many of them live in what we call food deserts. And here's just a food desert map of Memphis. And there's different ways you can adjust this food desert map if you go to the USDA website. But just keep in mind that, in both rural and in urban areas, there are food deserts where people don't have access to fresh fruits and vegetables. And so it's much more difficult for them to get real groceries. And often they rely on the corner store or a neighborhood store or out in the country, like a little community store. And someone's put this together before sort of as a joke, but it's true. The bodega, which is often a term used for corner stores in more urban areas like New York City, Chicago, et cetera, that what you might find there are things like, flavored or sugar waters, snack cakes, chips, and then, alcohol and tobacco, that kind of thing. And that it's hard to get fresh fruits and vegetables at those locations. So keeping in mind that sometimes all that families may have access to is stuff that's actually not good for them, or all that they may have access to easily is things that are not good for them. But when you think about this whole idea of banning sodas, And the fact that this is not passed at the federal or state level, ask yourself why that is. Why do you think that is? Do you think it's because people made the arguments about food deserts and about what's at the corner stores? Why do you think these have actually not passed? And you can actually pause the video and think about that for a second. Why do you think these haven't passed? Well, the reason they haven't passed is because the soda industry has come together and lobbied against the passage of these types of bills, because soft drink companies would stand to lose a lot of money. So they've poured millions of dollars, literally, into lobbying against these types of proposals. The soda industry alone in California had spent roughly $1.8 million on lobbying efforts, made close to $10 million in campaign contributions, and did donations of $94,000 to charity, all in an effort to try to affect not passing that would have banned the purchase of sodas with SNAP benefits. Now, just imagine if that money that had been used to try to not get something passed had actually been used to try to address hunger, to try to address food insecurity. Soda industry spent $67 million opposing state, city soda taxes and warning labels. Congress could cut soda and candy from SNAP, but Big Sugar is pushing back, so snack and soda companies basically fight against it. So you would like to think that, oh, well, it is because people are concerned about the health of SNAP beneficiaries or because we're trying to save money. No, it's because the reason it hasn't passed is because the way that we fund campaigns in this country, and the soda industry can assert pressure by withholding campaign funds or giving campaign funds. It helps you understand that there are stakeholders in policy making. So here, the soda industry, normally Coca-Cola, Pepsi are fighting each other, but they come together for causes like this, if you will, and they're the reason that the policies have never passed. And during the Trump administration, you actually had people who had worked for the junk food industry who actually became U.S. Department of Agricultural officials who, again, they administer SNAP. And when they became in charge of SNAP, they actually continued to ban this. And here's an excerpt from an email that shows that Secretary Perdue, the Secretary of the U.S. Department of Agriculture, was actually involved in trying to push down these bans on soda and candy. And we look further at food nutrition. You have programs like WIC, Women's and Children Healthcare and Medical Assistance. And again, this is where benefits.gov is very helpful in looking things up. We can also look quickly at Social Security and retirement. And you're probably familiar with SSI, SSD, Social Security disabilities for those who've paid into Social Security and become disabled. Supplemental security income is for those who are in poverty and disabled. So you can actually get both SSD and SSI if you have paid into Social Security and are disabled but are also below the poverty line. So that's just a sampling of some of the policies and how to analyze those. Let's talk real quickly about how to stay aware. If you look at things like changes that have come about due to the pandemic, you can always, monitor the state's website that you're in, whatever agency administers most aid. In the state of Tennessee, it's the Department of Human Services. So monitoring their press releases and getting, text alerts and email alerts for those. So to kind of revisit how to find and understand policy, general and static policy, meaning policy that doesn't change that much. Google is great for that. Use it. Wikipedia is also a great resource when used correctly. You can keep up with ongoing developments around policy by doing a Google News search. The Nashville area news outlets are really good in terms of changes that are happening at the state level in Tennessee. So obviously looking for news outlets that are in the state capital of the state that you're most concerned about. And then if you want more information about how do policies actually work, using Google Scholar, which you would learn about in your research courses, would help you to do that. So how can you follow legislation that's being proposed and whether or not it's being passed and how it's being changed? Most state legislators have good websites. Some include videos, committee meetings, and floor debates. Tennessee's really good about that. And then some advocacy groups have good legislative updates to keep you informed of what's going on. Google News, safe searches and alerts are really good. You can save a Google News search so that it will send you an email every time a news story comes out about the policy you're interested in. Listservs and email lists from advocacy groups are really good, like NAMI. NPR and NPR stations in the state capitals are good. As I said earlier, newspapers in state capitals. Then the New York Times, Washington Post, the PBS NewsHour, and BBC America are all news outlets I would recommend to you. And then in terms of analyzing policy, just some brief highlights. We've already done some analysis by looking at some different policy proposals. You want to look at intended goals and unintended consequences. Also looking at how well are the goals and consequences being measured, how often is the policy being assessed, changes being made based on the assessment, and which groups benefit from it and which groups are harmed. And we've also looked at how can we use trauma-informed practice as a lens for analyzing policy, but we could also use things like the Code of Ethics, the NASW Code of Ethics, National Association of Social Workers, the UN's Universal Declaration of Human Rights, or the Bible, or other value systems which you can, advocate around. In a state like Tennessee, obviously the Bible holds a lot of weight at the state legislature level because Tennessee's in the Bible Belt. And so relating your advocacy issues, your policy analysis to biblical principles is an important skill that you could actually use. And then looking at Maslow's hierarchy of needs. And then is the general public well informed about the policy? Do people actually know what's going on there? Now, all this stuff about politics can be confusing. I recommend the Crash Course series on YouTube on U.S. government and politics and the one on economics, so you can Google that and check that out. Khan Academy also has great videos about politics and economics, and then many advocacy groups have great resources as well. And then quickly to look at how policy is crafted, how to edit and create policy. You want to assess all stakeholders for collaborative potential. In other words, for example, in the food stamp thing, how could you possibly partner with the soda industry to come up with better health outcomes for beneficiaries? Set clear goals. What should look different when you get this policy enacted? Gather and analyze existing relevant policies. Gather new data or existing data for data-driven policies. And then strategize for potential opposition and pace the progress. Policy change is slow. It happens a little faster during crisis situations like the pandemic, like recessions or depressions that we go into economically. But for the most part, policy change tends to be incremental. How do we get policy enacted? Well, lobby legislators or other decision influencers, collaborate with other advocates, network with opponents, build public awareness and understanding, use social media, newspapers, TV stations, radio stations, make yourself available to be interviewed, testified, etc. And we go through all this in the foundation or generalist year of the MSW program. But unfortunately, advanced standing students don't have a policy course, so this is it for you. I wish I could go more in depth in these 2 hours that we had here. And then how do we implement and evaluate policy? Does it work as it's intended? There's lots of ways to think about this, but ultimately you want to measure the success of policy all the way through from the beginning and periodically, and not just wait till the policy's over or that it's been in existence for 5 years. You want to try to do incremental measurements of whether or not the policy is working. There's just not enough time within what we're doing here to go in depth on how to evaluate policy effectiveness. And really that's much more suited for a macro course or a research course. But ultimately, Google Scholar is going to be your best source to see whether or not policies have worked elsewhere. We've looked at examples, for example, when we were looking at the TANF program that implemented cognitive behavioral therapy, we looked at evaluating it and seeing that it helped with economic stability, self-efficacy, reduced depression, reduced alcohol and drug use. The main thing I want you to keep in mind from these 4 modules is the single most powerful knowledge and skill that you can build is how to find policy information online, because it's going to change. So learn how to do good online searches for policy information, and this will get better as you go along. Real quickly before I release you to take the quiz, a couple of resources I want to point out to you. If you want help with writing as an MSW student, check out my writing guide for students. And then if you have a hard time focusing or sometimes you procrastinate or have ADD, I would ask you to check out my Pomodoro resource. It's an amazing technique to use for procrastination and inability to focus. I would recommend you check that out. And then I would ultimately say to you, stay balanced. I have a link here that talks a little bit more about that you can check out. And then finally, if you want to know more about me, you can check out my LinkedIn page or follow me on Twitter, where I do a lot of policy updates. There's also my email address. Also, I'm the co-host of a podcast about men's mental health, and I do some YouTube videos about men's self-care, things like that. You can check all that out at takecareman.com. Ultimately, thank you so much for watching these and for being in the MSW program. Welcome to Union University, and Godspeed. Stay healthy, stay balanced. And as I said at the beginning of all this, you can get the slides at PolicyBridge 2020. So bit.ly/PolicyBridge 2020.